Good day, everyone. Dr. Yakub is my name. Wildlife Hospital, Abuja. It's a conversant with our series of health talks. Today, we are going to talk about something related to men's health. Specifically, we want to talk about what happens to men related to their health, especially after the age of 40. We know there is this common saying that life begins at 40, but then, ironically, and in reality, as far as medical health of a man is concerned, life begins to deteriorate at 40. And so, for this reason, it's important that men take note of this reality and take note of certain things that they need to do for themselves to maintain good health beyond the age of 40. Now, why the age of 40? Before the age of 40, in the growing period, the rate of wear and tear of body tissues is far less. That is when we're growing up. But when we get to 40, of course, by 40 years of age, you have actually lived long enough to the point that your cells generally have begun to experience and suffer a lot more wear and tear than repair processes. Now, in addition to this, people who have certain genetic predisposition to diseases, for instance, things like hypertension and the rest of them, also may have begun to experience genetic issues that will make this disease come up. Now, this also interplay with environmental factors and lifestyle changes or lifestyle habits that tend to now interplay together to predispose men to certain disease conditions which may creep in silently without them knowing. So for this reason, it's important that men take note of their health and specifically avail themselves with certain screenings for some of these diseases that may come up without their knowledge. So I'm going to mention a few of them which we need to take note of. Number one on the list is hypertension. Of course, hypertension simply means that the blood pressure within your blood vessels is very high. And once that happens, there are a series of health changes that may accompany that. And specifically, hypertension may increase a man's risk of developing what we call stroke or heart diseases, which of course may compromise his life eventually. So it's important that after the age of 40, we screen ourselves for hypertension. And the screening is actually very simple. You just walk up to a healthcare facility where you sit down, relax for a few minutes, then they measure your blood pressure with special devices that are meant to do that. I would advise that for these screening purposes, it may not be wise to do it at home, especially the first time. It is better to go to a hospital or a healthcare facility to check your blood pressure. If it is normal, of course, they will tell you. If it is high, the first time they might tell you to come back some other day to check. But for those who are not hypertensive and you don't have a risk factor for hypertension, maybe family members are not hypertensive, then you can go back home after a month or two, or sometimes 6 months. You can go back and check. But for those who have risk factors for hypertension, other family first degree relatives are hypertensive, or you're obese, or you have diabetes, or you have kidney diseases, you may do well for yourself to check much more often, maybe once in a month. Of course, once you are diagnosed with hypertension, thereafter, doctors or your healthcare givers will tell you what you need to do to take care of yourself. So, hypertension is one disease that we need to look out for after the age of 40. Now, the second one, which is also common after the age of 40, is diabetes. Diabetes is a sugar problem where an individual has too much sugar flowing in his blood. Now, what's the implication of this? Sugar in itself is called a pro, or glucose is pro-inflammatory. What that means is that it causes blood vessels or tissues to get inflamed or swell. Now, when you have diabetes, there are several organs that can be affected by this. And because a lot of times, by the time it starts, you may not be aware. So it is important that after the age of 40, especially if you have a risk factor for diabetes, your lifestyle, obesity, family history for diabetes, and all of that, similar to what we said for hypertension, it is important to check yourself. How do we screen for diabetes? Simple, you go to a hospital or a lab, they will take your blood to measure blood sugar, and sometimes this may be measured in your urine. Once the sugar is high, then of course you'll be told what to do. But I must say this, the common test that we do for sugar test, which is called fasting sugar, sometimes does not catch people who are pre-diabetics. That is, if you haven't developed diabetes fully, when you do your fasting sugar, it may not show immediately. So there are other tests that can be done. But of course, if you go to your health caregivers, they know how to screen you to determine whether you are pre-diabetic or you are frankly diabetic. So diabetes is the second health condition after the age of 40 that we need men to screen themselves regularly for. Now the third one, it's related to prostate health. Men, of course, have these common problems related to the urinary system. And there is this small organ somewhere down there that is called prostate. Prostate usually gets enlarged as we get older as men, and particularly beyond the age of 40. So it's important to also look out for that. And there are two things we may have to check out for. One is enlargement of the prostate, and then the second one is cancer of the prostate. Enlargement of the prostate usually, in most cases, may come with symptoms that the man may observe, which usually, in most cases, come with frequency of urination, particularly at night. But there are a lot of men whose prostate is enlarged and they don't know. So for this reason, it's important to check. And how do we check for prostate enlargement? It's just an ultrasound scan. If you go to an appropriate place, you scan your prostate, the doctors or your radiographer or sonographer will tell you whether your prostate is enlarged, and therefore he or she may refer you to an appropriate doctor who will manage your case. So the second thing about prostate is prostate cancer. There is a screening modality for that, and the screening for that is what we call PSA. It's a blood test where a chemical that is produced by the prostate gland is tested for. So when the value is above certain level, you may be told you have prostate cancer or not. But this screening is important for men above the age of 40. Now, the fourth disease condition, which is also getting common these days, that men should screen themselves regularly after the age of 40, is cancer of the rectum, colon cancer. This is also becoming more and more, especially as we adopt refined diets and all of that. So colon cancer is one of those things that can creep into a man's life without him knowing as well. And the standard way of screening for colon cancer is actually a colonoscopy. A colonoscopy is a medical diagnostic procedure where a small camera is put through the anus into the large intestine and then checked through. If there is any suspicious lesion in the intestines, the large intestine, the doctors will take a biopsy and send for analysis. If there is cancer, they will see. If it is not, of course. So that's the standard way of screening for cancer. However, for those who may not have access to colonoscopy, there's a simple blood stool test which is called occult blood in the stool. However, this is not diagnostic. This is not a standard screening, but sometimes in places where you don't have access to colonoscopy, you can do that. If stool is taken and there's occult blood means hidden blood in your stool, and that is becoming a recurrent thing, then it's very necessary that you go out and seek for colonoscopy to check for the reason for you passing blood in your stool. And so that's the fourth thing. So the last medical condition that we need to screen out for is related to cholesterol. I'm sure a lot of us have heard about cholesterol. And what's the danger in cholesterol? Cholesterol seems to smear blood vessels and reduce their caliber and predispose people to heart attacks or strokes. So it's also important, especially when our lifestyle or eating habits are not good enough, we tend to have high cholesterol levels. beyond the age of 40. So it's important that we take note of all of this. Now, almost all of these disease conditions or medical conditions we mentioned, they do not come with any particular signs from the beginning. They creep into your body without you knowing. And that is the reason why we emphasize the need for screening. And at any point you discover you have any one of them, the best thing you can do for yourself is to get help from appropriate places. And therefore, by the grace of God, you can maintain your health beyond that. Thank you very much.